Hi guys, it's Beatrice from the Bloom BMX. Today we're at Burlington Sports and Spine to talk about concussions. I'm with Dr. Ashley today, and she's going to be going through a lot of information about what concussions are, what to look out for, and everything else in between. So, hi, Dr. Ashley.
Hi.
Could you tell us a little bit more about you first off? Like, who are you?
Yeah, sure. So I'm a sports-based chiropractor. I've been here at Burlington Sports and Spine for close to almost 15 years now, and we've been specializing in concussion management for about the last 10. So my background is definitely in sport myself. I played all sorts of sports growing up, and that's what led me into this field. So we work with all sorts of people. Usually we have more of an active population, and I also have 2 kids who play sports. My husband is a phys ed teacher, so I'm in the sporting world, and concussion is a big part of that. The research is rapidly evolving, and we know a lot more now than we did 10 or 15 years ago.
I feel like concussion and the topic of CTE really exploded for our world because of Dave Mira. What is the latest on CTE right now?
Yeah, so the research surrounding CTE is really gray. Most of, I would say, the general population heard about CTE surrounding football, and the NFL has a big, brain injury research focus now. And like I said, the concussion research is evolving so much, but certainly we're learning that repeated traumatic concussions or brain injuries that are not recovered, that are not treated properly and managed properly, can potentially lead to CTE, which is more of a long-term condition that unfortunately has a much higher risk of suicide and depression. So there's no direct correlation yet established, but certainly things are trending that way.
That's good to know. That's rapidly being researched, though.
Yes.
That's good to know. Let's talk about what concussions are then. So I recently had a friend who knocked herself out, and I am seeing more concussions in the female space because more women are getting into action sports. It's a generalist issue, but I feel that with my experience, what I went through, I didn't know what to do. So she knocked herself out. She was snoring, completely just taking a nap midday. And it took her a while to get to the point where she could actually form words. It was only minutes, but it felt longer. So in that moment, I didn't know what to do. I was told not to touch her. She was wrapped around her bike. With your professional background, what is the proper thing to do in that case?
Yeah, so in that particular case, you may be suspecting a spinal injury as well.
Yes.
So correct, you wouldn't want to move her in that case. Concussion and being a loss of consciousness does happen somewhat frequently in concussion, and that requires definitely an assessment from a medical professional if your person is having a loss of consciousness. Some other things to watch for, some big red flags to watch for would be bleeding from the ears, worsening symptoms, like once they do come to, if they're worsening in symptoms. We worry about brain bleeds or skull fractures. Those are some big red flags for concussion. So certainly with a concussion of that magnitude, your friend should be going to be assessed. That's not something you just want to manage on your own.
Yeah, we definitely had a group of people around us. She was quickly sent to the ER just to make sure she was okay, and it took a couple of hours for her to stop going through that repeat. Aside from the brain bleeds and the repeating, what are some other signs to look out for that might be a little bit more uncommon?
Yeah, so vomiting and repeated and worsening vomiting is another problem. That signals an increase in intracranial pressure, which is very dangerous. So certainly watching for that. And like I mentioned, just deteriorating symptoms. So it's very common that people go into that repeating mode and that they have a headache. Those things are common, but if that is not getting better very quickly, like within the first few hours, then you definitely have to worry about red flags. And even just looking at the context, like how did it happen? Did they fall from a height? Was the collision high speed? All of those things need to be taken into consideration. A concussion is actually a stretch injury of the brain. So we used to think it was your brain hitting the inside of your skull and it was a bruising injury of the brain. That's now changed, and we know that it's a stretch injury of the neurons of the brain. So very often in a concussion, if somebody is to go get imaging, like a CT scan or something, it's not going going to show anything because the brain is not structurally damaged. It's temporarily stretched, and then those neurons go back into position. But in the meantime, they've created all sorts of inflammation and other issues, and that's where that fatigue comes in, or memory problems, that sort of thing, lack of focus, because your brain is busy healing itself rather than being able to focus on cognitive functions.
I had someone ask if brain rattle was a possible thing that could cause a concussion.
Yeah, that's no longer the case. And when I started down the concussion management road over a decade ago, it was just starting to come to light that that was not the case. Like when I was in school 20 years ago in chiropractic school, we were taught that it was a coup contra coup injury, meaning your brain is bouncing forward and backward inside your skull.
Right.
We now know that's not the method of concussion.
So it doesn't necessarily have to be direct though, because I think in this case she completely body bagged herself to the ground.
Absolutely.
Yeah.
A concussion does not need a hit to the head. It can be a hit to the body. It can be even a sudden acceleration, deceleration, where your brain is traveling faster than your body. So yeah, it does not need to be a direct impact to the head.
That's good to know.
Yeah, and that's where a helmet comes into play. Like a helmet
Yes.
will not protect against concussion, but it can protect against obviously other injuries like a skull fracture.
Okay, that's good to know, because there's a bit of a controversy with helmets right now.
Right, there is. And my son is a football player, and there's a lot of marketing surrounding very expensive football helmets that claim to reduce concussion. And the reality is the research just doesn't support that claim yet. It might down the road, but right now, that's not the case.
That's fascinating. That's really cool.
Right.
Let's talk about what a normal amount of time is for a recovery. Like what is normal and acceptable, and what is concerning that we might have to go back to the ER or a specialist.
Right. So typically how a concussion will go is you'll start to climb a mountain of symptoms, and things may get a little bit worse for a few days. Around day 4-ish is typically when symptoms will peak, and then you'll start to feel better quite rapidly. 7 to 10 days, and you should be feeling quite normal. We usually advise our athletes that the earliest they can return to play, meaning back to their full contact sport, is in the 10 to 14 day range. That's assuming no complicating factors. If you're symptomatic beyond 4 weeks, that puts you into a post-concussion syndrome diagnosis. So 4 weeks is kind of that magic number. If you're still having symptoms, you're not considered a concussion, you're considered post-concussion syndrome. And that can be caused by a number of things. Brain inflammation, just improper management is the main reason we see people slipping into that diagnosis. If a concussion is managed properly right from the beginning, very often you can be feeling back to normal within a couple of weeks.
Okay, so what is proper management? Because when this happened, I said no sugar, no caffeine, no screen time.
Right.
What else?
Yeah. So we do like to minimize inflammatory things such as red meat, dairy, alcohol, sugar. Those are kind of the big four we like to minimize, just because generally
We like all that, unfortunately.
That's right. All the good stuff, get it out of there. But those are just pro-inflammatory things, and we want to minimize inflammation in the body. So certainly those are things you can do just from a nutritional standpoint. The first 24 to 48 hours, we still advise general rest, and I don't mean laying in a dark room doing nothing for 48 hours. I just mean, you're not going to go out and like walk the dog for an hour kind of thing. You're going to lay low at home. You're going to minimize screens. Our guideline is typically sub-symptomatic activities. So what I mean is anything that's not flaring you up, you can continue to do. So for example, if you're on your phone and you start to notice your symptoms are worsening, then you're going to shut that phone off and you're going to wait for things to settle, and then you're going to go back to it. Same thing goes for watching TV or reading a book or paying bills online. Anything that's making you flare up in those first few days, you don't want to push through those symptoms. So it's kind of like a relative rest approach.
Okay. How do you feel about, especially as these athletes are traveling and they're getting injured overseas and, it's time to go home? Is there any concerns with like flying?
There's no concerns with flying as long as the red flags have been ruled out, because intracranial pressure is like, if we're suspecting a brain bleed, certainly flying would be contraindicated at that point, but no. Typical concussion recovery, there's no indication that flying is a problem.
Okay, good. Yeah, because I was thinking about the pressure being in the air and all.
Yeah.
So you're doing all the managing, you're still feeling some symptoms. Do let's say I didn't know who to go to. What are some key things I can Google to find a specialist?
Right. So this is really changing. The general public can access concussion clinics a lot more readily than they used to. Certainly, if you see any red flags when you're initially concussed, ER is your first stop. From there, though, I would just simply Google concussion management, and you will very likely find a concussion specialist in your area. Here at Burlington Sports and Spine, we're part of a network of concussions called Complete Concussion Management, CCM, and they're Canada-wide. So, for example, say you're traveling to BC, you have a competition, you get concussed, they can look up your data on our online portal and see your previous concussions, previous injuries, how they were managed. So yeah, concussion management is coming a long way. And in defense of medical doctors, they're often given clearance power. They're the ones to sign off on a concussion, but they don't always have additional training. That's not a part of medical school. So I would definitely look for somewhere that has specialized training in concussion.
Okay, very cool. Have you dealt with any athletes that have had repeated concussions, and have you ever had to give the advice like, "Hey, maybe it's time not to do the sport"?
Yeah, so one red flag in that regard is if concussions are happening with less force. And I have had that happen in some of my teenage hockey players, kids who've been concussed multiple times, maybe mismanaged and didn't recover properly from some of those concussions. And then all of a sudden they're getting a concussion just from the tiniest hit to the head. That's a red flag. That means your brain is just not at capacity to withstand that. So yeah, that's something to be aware of. If you're getting concussions with considerably less force, you need to start to think about pulling out of your sport.
Yeah.
Or a number of concussions in a short period of time. Now I can't give you like X in X number of months because it's very situation dependent and how you recover. But yeah, multiple concussions in a short period of time or concussions that happen with less force, those are worrisome scenarios.
Let's talk about exercise. Now, I'm starting to see athletes do focus exercises where they have a ball and then it's moving and they're just kind of like concentrating and following it. And I think that's something good to do even if you haven't had a concussion. But yeah, let's talk about workouts and exercises.
Yeah, so it just in regards to that visual or vestibular piece that you're talking about, that is one of the symptoms that can linger, kind of that balance, dizziness, brain fog sort of feeling. So if that's the case, it really depends which area of your brain is most affected. And for some people, it is that visual vestibular piece. So certainly sometimes we refer out to specialized optometrists for that if we can't manage that in-house, but those vestibular exercises can be really helpful to kind of get people over the hump. But yes, in regards to exercise, so many years ago, the management of a concussion was just rest in a dark room for a week or two and you'll feel better. Now we're really flipping that narrative on the head. And in fact, for most people that come in, their second visit of a concussion management case, we get them on the treadmill to see their capacity for exercise. We want people moving for several reasons. One of them being blood flow. Blood flow helps to heal everything, so that's what we want. Another being mood. A lot of the people who get concussed, they're very active people. They're used to moving. And so when you take that away from them, that can really affect just how they feel in day-to-day life. So in regards to exercise, it's a progressive method. So we get them onto the treadmill, ideally for 20 minutes with progressive incline. But every minute as we increase the incline, we're asking their symptoms. This is a walking test, by the way. So we're just trying to slowly increase their heart rate and see how their symptoms respond to that. So we get them to a certain level, and when their symptoms start to worsen, then that becomes like their exercise standard. And we know, okay, you can handle 10 minutes at this heart rate, so that's where we're going to start, and we're going to get you doing that every day. But yes, for most concussion patients, it's really beneficial to get a little bit of aerobic exercise, even within those first few days. And by aerobic exercise, I just mean elevating your heart rate slightly. So taking the dog around the block, getting on a stationary bike for 10 minutes. Some things to keep in mind is you don't want your symptoms to be flaring when you do that. So you're still saying subsymptomatic. If you're on the exercise bike and you start to feel worse, you're getting off the exercise bike. You're not going to push through. But yeah, we want little doses so your body starts to get used to that.
Very cool. Yeah, I think especially as athletes, we want to be able to move, and getting that permission is actually a good thing. So, in regards to the topic of moods, I think that was the first thing I was thinking of when I saw my friend crash was, oh no, am I going to lose this person, their character, their mood? Is there any studies right now to support that, that person's going to come back if they were to go on the other side of, the depression end of things?
Right. So, concussion by definition is a temporary brain injury. So, it is not going to last long term if it's properly managed. So, personality should return to normal. But that being said, those first couple of weeks when you're symptomatic, emotions play a big, big role.
Yes.
And we have a checklist of symptoms that we ask people, and a handful of those are emotion based: increase of sadness, increase of irritability, increase of apathy, and increase of feeling nervous or anxious. Those are very, very common concussion symptoms, and they'll typically resolve within the first few days.
That's good, yeah, because
Yeah.
I've seen a couple cases where the individuals have gone into like a preteen state of just being super moody, and it's like,
Yes.
they're really hard to be around with. But that's good to
Yes.
know that does subside.
Yeah, and long term too. I mean, a lot of these people who are being concussed, like we said, activity is such a big part of their life, so they're kind of mourning the loss of that for a period of time as well. So I think that really plays into the mood too. So some of the moodiness you can blame on the actual concussion, and then some of it is just situational.
You went through a lot of information. Is there any other tidbit of information you want to throw at us just so that we're aware of? I feel like we covered so much already.
Yeah, we did for sure. One thing we haven't talked about is whiplash. So whiplash is often very tied to concussion, depending on how the person is concussed. But whiplash and concussion symptoms can also really mimic each other. So I've had a lot of concussion cases over the years where the headaches are actually being caused by the neck, by the whiplash piece, rather than from the concussion piece. So really important to also address the neck when you're dealing with concussions, because that can really play a big role.
So how do you treat concussions here at the clinic?
Yeah, so a lot of it is activity management and education. For the first couple of visits, people just don't really know what to do, so we guide them down that road. And then we also do a lot of manual therapy on the head and neck. So, massage, cold laser, potentially acupuncture. Like, we're just trying to get the neck moving well again after that impact. But yes, a lot of it is simply an education and managing how they go about their first few days.
Awesome. Thank you. Well, thank you so much for making the time to do this. I've been wanting to do a podcast for a super long time, and the situation recently with my friend having a concussion really inspired me to do this, because I realized a lot of people don't know what to do, and I definitely didn't know what to do. So thank you so much for being on this channel. Guys, like and subscribe, the whole YouTube thing. Check out Birth and Sports and Spine. Thank you, Dr. Ashley.
Thank you.
Thanks. Okay,
Good.
that was easy.
That was
Yeah.
easy.